Have you ever met a new mom whose baby was barely a month old, but the mom doesn't connect with the baby? The mom doesn't want to be around the baby. The mom doesn't want to carry the baby. The baby could be crying and the mom would just be sitting there and looking at the baby without doing anything. And then you wonder, why is she such a bad mom? Hey guys, welcome to a new episode of Talk Life with Teg. This is still your girl, the Ego Girl. And today we're going to be talking about a topic that a lot of people are actually ignorant about, and it's causing a lot of harm to new moms and their new babies because of this ignorance. So let's dive into it. We're talking about postpartum depression. Postpartum depression. Postpartum means after delivery, and depression is a common word that we know. But when we talk about postpartum depression, it's a complex mix of physical, emotional, and behavioral changes. It's not just one thing, and it happens in some women after giving birth. It usually begins within the first month after delivery, and it's been linked to some chemical, social, and psychological changes that happen when having a baby. For example, the estrogen and progesterone levels, the hormones that in a woman that are very high during pregnancy. But once the woman has her baby, within the first few days of delivery, those hormones drop right back to their normal levels. So these sudden changes in these chemicals and other social factors, you just had a new baby, maybe the stress and people around you and every other thing. So a mixture of these things can lead to a mom being depressed right after having her baby. And it's been said that 1 in 10 women who have postpartum depression will eventually develop a more severe and longer lasting depression. Research has also shown that 1 in 10 new fathers gets depression in the year their child is born. And this, like I said earlier, this can also be linked to other social and psychological changes. A lot of things. Having a baby changes everything about you, changes everything about your life. So that kind of pressure and that kind of sudden change could lead some people to get into depressive moods. So before we dive into what I have to talk about postpartum depression, I want to say first of all that the mother who is suffering from PPD, postpartum depression, didn't do anything wrong. If you're a new mom listening to this and you're in this situation, or you have experienced this before, or you know someone around you who is dealing with this right now, the first thing you need to know is that you didn't do anything wrong. This mom didn't do anything wrong. In our society, we are used to blaming women for not being able to take care of their babies or not doing what we assume they should be doing. I mean, you didn't write the rule book. Why judge a new mom? She's still trying to figure out her life and things like that. And it's usually not just for first-time moms. It can happen at any pregnancy. It can be the second or the third or even the fifth. And in fact, the higher the number of children you have, the higher the chances of having postpartum depression. So what are the signs that can be seen that will say, okay, even though before you can say this person is suffering from PPD, there has to be a clinical diagnosis. But then what signs do we need to watch out for? Well, the first and frequent signs can be hard to point out because most women generally show these signs after delivery. And that is things like trouble sleeping, appetite changes, severe fatigue, lower libido, frequent mood changes. But then the most serious signs that also accompanies these earlier signs I've mentioned is being uninterested in the baby. Naturally, a woman bonds with her baby even before the baby is born. And once the baby is out, she wants to hold her baby. She wants the baby to feel her heartbeat. She wants to carry the baby all the time. But you see this new mom totally uninterested in her baby. She's always crying, she's always cranky, she has severe anger issues, and then she starts to feel worthless and helpless and hopeless. And sometimes suicidal thoughts. She could be thinking of killing herself. She could also be thinking of killing her baby. She could be thinking of hurting her baby in other ways. She could be thinking of hurting someone else. And sometimes panic disorders may also appear. So when we see things like this, these are serious red flags that we should look out for. So when we're talking about PPD, there are serious red flags. And sometimes actually you might leave that mom with that new baby and she would hurt herself and her baby seriously. Not because she wants to, but it's a mental disorder actually. And if left untreated, it can worsen into severe depressive psychosis. It's a very bad situation for any mom and her baby to be in. So what can be done? Seek help. The mom and the new mom and the new dad and family, once they notice this kind of thing, seek help. When the mom can't function normally, when these symptoms persist beyond like 2 weeks, when she can't cope with everyday situations, when she starts thinking of harming herself and her baby, please seek help. There are medical treatments, there are therapeutical treatments, that therapy sessions that can be used to get these moms back in order, to help them deal with this situation. It's a very dangerous situation for a mom and her baby to be in. But what really predisposes women to falling into this situation? You can't really say it's one thing or the other, but there are a few things that have been seen to be risk factors. Now, that these things are present doesn't mean that the woman will develop PPD after having a baby, but they are risk factors. There are things that you could watch out for. First of all is a history of depression. If this lady has been diagnosed with depression in the past, there are higher chances of her developing postpartum depression after having a baby. Young age is a risk factor. The younger you are when you have a child, the higher the chances are for having PPD. This is one reason child marriage is also a very bad thing, because by the time, even if in our previous episode we talked about the harms of child marriage, and I didn't mention this one, but I'm talking about it now. Even if there is a successful delivery, there is a very high chance of PPD. So young age is a risk factor. More children, when somebody has had more children, maybe this is like your 5th pregnancy, there is a higher chance that after this pregnancy, maybe because of the stress of having more children in the house, especially if they're not well spaced and things like that, then going through an extremely stressful event, maybe the loss of a partner, maybe the loss of a job, the loss of a loved one, something very stressful that happened right before you had your baby or just after you did. The stress coupled with every other changes that your body is going through or the woman's body is going through could lead to this situation. And having a child with special needs or health problems could increase anxiety, could increase stress, and could lead a mom into depression right after having her baby. And then if a woman has limited social support, maybe you don't have friends and family around to help, not a lot, but few that around that could help, that will support through the pregnancy, especially towards the end and the first few weeks after delivery. And any new mom needs help. Every new mom needs help. And that's why I like the Igbo culture, the omogo thing, where the mother comes around to help, and sometimes maybe the sister or the mother-in-law, someone comes around to help the mom so that she can get enough rest, she can learn how to handle the new phase of life that she has found herself in, and things like that. So these things, when there is a limited social support, it could also increase stress, increase anxiety, and all of them. So as a new mom, like I've said earlier, ask for help. Even when you are not depressed, it's okay to let people around you know that you need help. You're not a superhero, you're not a superhuman being. You need help. It's okay to ask for help from close family and friends that could help you take care of your baby, that could help you take care of other needs around the house. Your husband, your partner, the person you have the baby with should be able to help around. And I think a few months ago, I heard that in civil service in Nigeria, that men, I don't know if it has started or they're planning to start it, to give new fathers paternity leave, which is very important because they also need to be home to help around, to bond with their babies and to help the new mom as well get around. So it's something that is nice. So a new mom, don't try to do it all. Please ask for help. Exercise mildly. Exercises will help you with the stress, help you with the anxiety, help your body to get back in order. Keep in touch with your family and your friends. The love, the support, the joy, the happiness in their voices that you just had a baby, you need that. You need that to keep your head in order. You need that to help you relax. And limit visitors when you first get home. You just had a baby, you got home from the hospital, and your whole neighborhood is there to say welcome to the baby. I know they're happy for you, but please, they can spread out through the month and come in to visit. Limit visitors. It's an overwhelming thing. It's a stressful thing. So as much as you can, when you first get home, limit the number of visitors. I know people that don't tell people that they've had a baby till after a couple of weeks so that the mother can rest before visitors will start coming around. And then have realistic expectations. Like in our world today, there's this pressure of snapping back immediately you've had a baby. You want to go back to the figure that you had before you had your baby. It's going to happen or not, but then it's going to take a while. Don't expect that you will snap back and then you put pressure on yourself that your body is not looking nice. Don't expect that your baby will begin to walk in 3 months. There are so many unrealistic expectations that mothers put on themselves and their babies that increases anxiety and stress. So please have realistic expectations. Talk to your medical practitioner about what is normal for you, for your body, and that of your baby at that early stage. So you know what to expect. You know that if this thing is delayed, this at this point in time is not really a problem, so that you can relax and take care of yourself and your baby. And then sleep when your baby sleeps. This is also why you need social support. You need help around, because some mothers are awake all night because the baby's sleep pattern hasn't been put together. So the baby is waking up every 30 minutes, every 1 hour. And you're awake all night with the baby, and then all day you're trying to take care of the baby. And when the baby is sleeping, you are trying to maybe cook or wash the baby's clothes or do one thing or the other. You will say, let me do this before the baby wakes up. Please. Sleep when your baby sleeps. You need the rest as well. Let your partner help out. Let a family member help out with all those other things. And hopefully you have the support that you need, so that you will take time to rest and let your body and your mind be in a good situation. But this is just a summary of what postpartum depression is. And like I've said, if it's left untreated, it can worsen. Then the treatments, therapy, like I've said, medications and social support, these are the things that is needed. If there is no treatment, the issue can be prolonged and it could worsen, like I've already said. So please don't treat the mother like she's a bad mother, like she's not doing right. Don't look at her like, I don't know, but our society, we are very judgmental, and instead of you to lend a helping hand, you're standing and you're judging the new mom who is trying to figure out her life. So please, let's do our bit around moms like this. And if you're a mom in this situation, know that you didn't do anything wrong. All you need is help, and get the right kind of help, so that you and your baby and your family, that your joy will not be cut short. You will live happily, you will enjoy the bliss of being a new mom, and you will raise your baby well. So that brings us to the end of what I have for us today. Thank you very much for tuning in again. God bless you. Bye.